Guys, welcome back to Medical Coding with Blue. Today's episode is all about what are continuing education units in medical coding and where do you find them. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So it doesn't matter that it's just medical coding I'm talking about today. There's many different credentials that the American Health Information Management Association and the American Academy of Professional Coders, there's many more credentials that they offer, and all of them have a continuing education unit requirement. But today I'm just talking about the coding because that's majority of my audience anyway. So I want to say that really quickly. So if you have one of the four main medical coding certifications, or maybe you have two, okay? If you have the CCS, the CCA, the CCSP, or the CPC, right? These are all going to require CEUs. Now, if you are with a HEMA and you have the CCS, the CCA, or the CCSP, having only one of these requires you to get 20 CEUs in your reporting cycle, okay? So a reporting cycle is 2 years, and it's the same if you're with AAPC as well. It is a 2-year reporting cycle. Now, why are we required to have continuing education units for our credentials, to maintain them? Because if we don't report them, if we don't do them, we will lose our credential. Why is it important that we have these? Because we are in an intellectual field that requires us to maintain our knowledge. And we have to stay up to date on the latest and greatest. So that is why it is required that we have these continuing education units. So again, if you have one credential, the CCS, CCA, or CCSP, with a HEMA, it is 20. But if you have two, it is 30, okay? It'll go up to 30 that you have to report within 2 years. If you're with AAPC and you have one certification like the CPC, it is 36 continuing education units for one. Now, if you are a member of the associations, AAPC or a HEMA, they do offer continuing education units as a part of their membership package. So that's great. You know, you can earn CEUs that way as well. AAPC has some for theirs, but not enough to cover the 36. And HEMA has some for their people as well, but not enough to cover the entire thing. You're still going to have to come up with some, okay? Even if you have like just a regular membership, standard membership is like 5 CEUs that's included. If you have the Premier, then it's going to be 8, but again, you're still going to be short. You know, even if you pay your membership dues every single year, you'll only get 10. If you're just a standard member, Premier will give you 16 because there's 8 that's included for every year that you sign up, you re-sign up. And they tell you, you know, here's a list of all of the webinars or the quizzes that you have access to with the free CEUs. AAPC is a little different. I'm not really familiar on theirs, but I do know that they do have their magazine and they do have the free continuing education units that's included. I just don't know how many. But I wanted to talk about what kinds of classes they are. And so basically, one CEU is considered 1 hour, okay? But sometimes if you're reading an article, you can get 1 CEU when you fill out the questionnaire or the quiz at the end, okay? Now, HEMA has that on their website. I'm sure AAPC has it on their website as well. Sometimes it depends on the cost. So the cost can be, of course, if you get the ones that's included with your membership, it's free. But it could be a minimum of $20. It can be way up to $100 per hour. I mean, for the 1 CEU. So it really all depends, right? I'm looking here when I go to and if you're interested in going to a HEMA and getting CEUs from a HEMA, you can go to the HEMA store and it will sort by product and things like that. So there's a product category and you can go to the classes that you can look up, like basically for outpatient coding, inpatient coding, for medical terminology and anatomy and that kind of thing. They have them all broken down. But this one is a CDI and quality outcomes training. If you are not a member, it's $459. If you are a member, it is $429. If you are a Premier member, which means you get just a lot more discounts, it's $400. And there's 4 CEUs that are included with this particular training. And it gives you the CDI and quality outcomes training course provides information on the impact CDI programs have on quality reporting within various healthcare settings. So if you're interested in something like that, this would be a great course for you. This course is composed of 3 modules, each focused on the specific healthcare setting. The first module covers content that focuses on the impact CDI has on inpatient quality measures. The second module explores outpatient hospital quality measures, and the last module addresses provider quality measures. There are activities throughout this self-paced course to help the learner measure their understanding of the content. Each module includes a quiz, and there is an end-of-course assessment. At the completion of this course, the learner earns four AHIMA CEUs or 4 continuing nursing education contact hours. So either or, okay? Let's see. The American Health Information Management Association is accredited as a provider of continuing nursing education by the American Nurses Credentialing Centers Commission on Accreditation. So this is a valuable course. If you are a nurse and you need to get some continuing education and you want to do this specifically, you're able to report these. If you have an AHIMA credential, obviously these are good for that. So you would get 4. If you had the Premier membership, it would be $400 for this course. If you are not a member, it would be $459. So that's how expensive these can get. I mean, you can get the journal quizzes, and they're $20 if you have the membership, the Premier membership, the membership. But if you're not a member, then it's $30 for the 1 CEU. So again, it can get very pricey really quickly, especially if you're not working in a place that provides the continuing education units. That's where it can get a little expensive very fast. But there's ways to find free CEUs, and that's something that you have to do your research on. Please don't ask me, guys, because I'm not in the business of sharing that information of where to find the free ones. There's a lot of information out there where you can find that. LinkedIn is a great place to find leads for free CEUs. But please don't be like these people that say, well, I'm looking for some free CEUs. Does anybody have, anybody at an organization, can I just sit in on your web? No, come on now. No, you have to be willing to spend some money. But I understand it gets very expensive and times are hard. I understand. Trust me, guys, I get it. But at the same time, too, this is the field that you're getting into. Now, if you pay attention to some of these vendors that are with these companies that are health information related and things like that, you'll see those where they say, oh, well, we have a free CEUs or whatever if you attend this webinar or whatever. And then all you have to do is just sign up. And so they tell you about their whatever it is that they're educating on. Sometimes it's for education. Sometimes they're talking about a product and how it's beneficial and things like that. So it really all depends. But you have to look on LinkedIn, guys. There's a lot of them. There's in March, they have some of these but these companies have March Madness, and one company, and I can't think of the name off the top of my head. I honestly can't think of the name off the top of my head. But they have 1 CEU free for 30 days in March. Every single day they have a CEU that you can earn. All you have to do is listen to the webinars or whatever it is. And so that's a great way to earn some CEUs. But here's the thing about AHIMA. So AHIMA put out a while ago, when I was in Baltimore, I started hearing about it, about 40% of your CEUs have to come from AHIMA if you're with AHIMA. Now, the reason that they said that at the meeting was because they said that they want to ensure that the quality of the education and that kind of thing that's being provided and that kind of thing, that they know, that they have knowledge. Of course, it's going to help AHIMA because obviously then you'd have to spend money directly with the association, right, in order to meet their need for that. If you're a member and you get those free CEUs, then that's going to put you at a place where you're going to be able to earn enough of that 40%, so that, if you had free ones, that would be fine, and you'd still be able to, be, okay with your CEU requirements. But for those of you that are not members of AHIMA, this could be a problem, right? Because that's an additional expense every single year, and the membership dues are going up. The Premier membership dues are going to go up to $209 next year. So they were saying that beginning in 2024, that they were going to, implement this 40% rule on on when you're recertifying and you're reporting your CEUs and things like that. But it actually got pushed back to 2025. So there's a little bit of a breather, and there was a lot of people at the conference that were complaining, saying, it's going to cause a financial hardship for some of these coders that really rely on, these free CEUs that they earn from their work. And, if you're like my work, my work has AAPC CEUs, which you can report to AHIMA. They do accept those. But if I wasn't a member and that's all I was reporting, it might be a little bit of a problem again. So that's something that you have to be prepared for, because when it comes to maintaining your certifications and things, it's very important, because you don't want to be without your certification. You don't want to lose it just because you can't afford to pay. You need to look at other ways of getting involved so that you can find ways to make it more affordable. There are affordable CEUs out there, but you have to do your research. Again, do not ask me. Do not ask me, because it's hard enough to keep track of some of those things. But you need to be able to do your research as well, folks. Okay. If you go to the conferences, the annual conferences, that's a great place to collect CEUs all in one one fell swoop too. Every class that you go to is good for one CEU, and so it's a great place to network when you're at these conferences. I always recommend the conferences. I will be attending the one in Salt Lake next year in 2024. So is it a little pricey to go? Yes. If you have the membership, it takes a little bit of that pressure off, because the price is a little bit lower. You can with those, you can have, for AHIMA, you can do the early bird pricing, which is a good deal. If you can catch it in time, that's always a good deal. So that's just something that you have to think about, guys. It is expensive, and it does get even more expensive, but this is a requirement to have your credential. So we'll see what happens with that 40% rule, because they pushed it back to 2025 just to give people time to get themselves, okay, that we're not just going to spring this on you, but it's something to be prepared for, and 20 CEUs or 30 if you have 2 credentials, 2 medical coding certifications with AHIMA, it's still reasonable. It's still reasonable comparatively. And that was one of the things that one of the people that was speaking about it was saying, that, hey, we don't require as many as other professions do. Well, we're not nurses, so you can't require us to have the same amount as nurses. But again, it's just something that we are responsible for. It's part of what we have to do as coders. Okay, that's why the association is able to do a lot of the things that they do, and it's the same thing with AAPC. AAPC requires 36 just for one, and then the more you get, the more you have to report. And then again, you don't want to be one of these people that's at the end of the year trying to hurry up and get their CEUs and report them all. You want to make sure that you are giving yourself ample time to get your CEUs in and be able to plan strategically if you need to, but it's a great way to keep your knowledge up. It's a great way to just learn different things. And sometimes even when you're having your HIPAA training, I get a CEU as well every single year that I do that at work. So I'm able to report that as well when I'm reporting my CEUs. And so it's just something that, it's out there. But It can be whatever you choose to get your CEUs in. Every credential is going to require different things, especially the specialty credentials with AAPC. Certain ones are going to require certain vendors only, their CEUs. Like the CPMA, which is why I tell people, especially that are brand new, don't get the CPMA, especially when you don't have experience. Because why are you going to sit here and say that you're an auditor when you haven't been audited? You know what I mean? Like, that doesn't make sense. But, you know, it's up to you, whatever you want to do. But I would recommend, like, thinking about it, right? Because you can't just go and find these free CEUs when you have the CPMA and expect to be able to report those and it's cool. No, they want you to be able to go to certain vendors, and those vendors can charge whatever they want to. They can charge whatever they want to in order for you to be able to meet your requirement to carry that CPMA. And it's the same thing with some of the other specialty credentials as well that they have. Not all of them, but just some of them, you know. So just something that you got to look out for, guys. You have to pay attention, and don't sit there and try to compare yourself to other people or try to compete with other people, because their journey is not your journey, okay? You can be just as successful with just one certification rather than all these other credentials, okay? These credentials, they don't mean anything if you don't back them up with experience. You know, it breaks my heart when I see people being taken advantage of who have a whole conga line of credentials after their name. Meanwhile, they have less than 2 years of experience, and they don't have any experience in any of those other specialty credentials that they got. They just passed a test. You know what I'm saying? So that's a lot of money that you're spending unnecessarily, okay? Now, I say in the first 2 years, start with one, okay? When you do that, that gives you time to get used to finding CEUs, get used to finding where your resources are so that you can find free ones, or you can find low cost ones, or you can find ones that are going to serve you well to help you to become a better medical coder, right? That's going to give you that time to be able to learn all of that stuff without having the pressure of, oh, I have this specialty credential and this specialty credential, and I can only get CEUs from this one, but they're so expensive. It's $45 for one CEU, or it's $60 for one CEU, and I just don't know how I'm going to make that up. Guys, come on, you know? And you don't want to lose your credential because you can't keep up with the CEUs. So make sure that when you are building your when you're building your credentials, right, that it is something that is going to be valuable to you in your position, that it's going to mean something different from what you've already said. It's like when I see people that have the CPC and then, oh, they're going to get certified in family practice. Why? Because that's the CPC has already tested you on everything that you're going to be learning for that family practice stuff, you know, or billing. You're already getting tested on reimbursement through the 4 main medical coding certifications. It's already testing you on reimbursement. You don't need to have a billing credential on your name. And if you look at the job listings, a lot of times when they're looking for billers, they're not even looking for them to be certified in billing at all. You know, they're not even looking for them to be certified in medical coding. They would love for you to have experience, of course, but most of the time they're just asking for a high school diploma or a GED, and that's it, you know. So again, think carefully and don't get sucked in, guys. Don't get sucked in. I see a lot of people that are spending money unnecessarily. They get really excited thinking, oh, well, if I go through this course, I'm going to have all the CEUs I need even before I get my credential. And that's wrong too, because you can't earn continuing education units until after you've gotten your credential. All the ones that you're earning beforehand, they do not count until after you get certified. And there's people that have gotten taken advantage before because of that too. They got so excited thinking, oh yeah, I'm already all done. I've got all my CEUs and everything. And they're not even certified yet. Don't do it to yourselves, guys. Please don't. I'm just telling you, be wise and look at the requirements. Whenever you have your certification, it will tell you what your CEU requirements are. If it's requiring you to have certain specialty ones, it will let you know. If it's requiring you to have a certain amount, it will let you know. And you're going to report them as you get them. And again, do not wait until the last minute, because there's nothing sadder than that when I see somebody doing that. And I've seen people try to post on my Facebook for my for Medical Coding with Blue. I do have a Facebook for Medical Coding with Blue. Somebody tried to post on there that they were looking for CEUs for their friend who is trying to hurry up and you know, report her CEUs. No, that didn't even make it past the screen thing, because I have all the comments screened, and it didn't even make it past there. No, you're not going to sit here and try to do that. Not on my channel. Okay, not even on my Facebook, because that's a responsibility that you know you have to have. You have 2 years to be able to report this. There is no reason that you should be waiting until the last minute. Do not procrastinate on that. And, you know, if you have to, there's the consequences of procrastinating. You either lose it or, you know, it gets revoked. You know what I'm saying? So that's your responsibility, guys. We're all adults here. We're all adults. So I'm just saying. But with that said, be on the lookout for those low cost ones. Be on the lookout for those free ones. But again, in 2025, when we do, if you have an AHIMA certification and you know that they're going to require 40% in 2025 to come from AHIMA, if you have the membership, you'll be fine, right? But if you don't, that's something that you got to keep in mind. Either you're going to get the membership and get the CEUs, that may be cheaper for you, or you can go to conference and, you know, you can be able to get CEUs that way. Sometimes your organization may pay for you to go to conference. That's something that you may have to ask. I'm not high up enough on the food chain yet for my organization to pay for me, but I do pay for it myself out of pocket. And I'm totally fine with that, because it helps me to gain my knowledge and become a better medical coder by listening to what's out there and what's latest and what's the newest thing that's happening. So I feel grateful for that. So that's the thing that, you know, you have to be able to be willing to make that decision again. But don't sit here and try to get all these free CEUs and thinking that you can just get by on that. You may have to spend money, okay? But be smart about where you spend your money when you're getting these CEUs, because again, the cost can be anywhere between $20 and $100, $150 for one CEU. You know, I've seen them up to $200, $300 for one CEU. You know, it really all depends on the quality of the product and what they're doing. But it will say, usually it will say, this is approved for one CEU from AHIMA or AAPC or both, okay? And again, if you have AAPC CEUs, AHIMA does accept those, okay? So with that said, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I'll see you all next time. Bye.